friends, Dr. Nancy Trimbley here, Trimbley Chiropractic, putting the power and knowledge of your health back in your hands. We're working on trigger points of a specific muscle in the lower back that will cause you to feel like you cannot bend forward, like you cannot bend forward to put your socks on. You can't bend down to pick up something off the floor. It's like these muscles are cramped. A lot of times that happens because you've been lifting a lot or lifting awkwardly. It can also happen if you've got an underlying issue with your spine or with a lower back disc and your body's trying to protect that and create a brace. So either way, there's a way that you can work on this at home. It's best to work on it with a partner. So as with any trigger point, you want to find the point and hold 10 seconds pressure. You know when you found the point when you press on it and it feels like it's sore and painful, but it's a good kind of pain. If it's a bad pain, you don't press on it. The muscle that we're working on is the quadratus lumborum. It's right here on the lower back. And if you can see on this poster, there are these raspberry colored and red colored areas. This muscle will refer pain to the sacroiliac joint, the butt, the hip crest, and also what feels like the hip joint on your thigh. This muscle is also can mimic sciatic pain, the pain that goes down the back of the thigh and even past the knee. So if you have that kind of pain, and when you press on this quadratus lumborum muscle, if you can feel that pain intensify, there's probably a trigger point in the quadratus lumborum that is referring that pain. So I'm going to show you how to work on that with a partner. So you need to have your patient laying on their side like this with both knees bent. And the muscle is deep, so we need to work on it from this angle. And usually I use my two thumbs, and you're going to go about 3 inches from the spine. So here is the spine. That's where I'm going to be pressing, and I'll press straight down. The muscle is only 2 to 3 inches long this way from top to bottom, so there's not that much room to work on. If you go too high, you'll be pressing on the rib cage, and that'll be a bad pain to the person you're working on. Remember, this should feel like a good pain. And I'm going to tell you, a lot of people have spasm here, and it can be sore, but it should feel like a good kind of pain. And you want to hold pressure on one spot for 10 seconds, and then move about a half inch or a quarter inch even, not that much, and hold pressure for 10 seconds. If the person you're working on says, oh my goodness, when you press there, I feel it in my butt or my leg, that's a really good spot. That's a trigger point that's referring pain. Take your time, make sure the person keeps breathing. Don't want to have them hold their breath. The oxygen is going to help to release the muscle spasm. And take your time. It should only take about a minute or 2 each side. Even though the person may only have pain on one side, work on both, because sometimes there's trigger points on both sides, even though they only feel it on the one side. So let's suppose you don't have a partner. You don't have somebody willing or able to work on your quadratus lumborum muscle for you. There is a way you can work on it yourself. You do this standing. You're going to use your thumb, or if you have one of those knobber devices you can find at some bed and bath stores, you can use that. You want to take your thumb, and you're going to put your hands on your hip crests first, and then where your thumbs naturally fall right here on either side of the spine, you're probably in the neighborhood of the quadratus lumborum. What you want to do next is lean back and a little to the side, and you want to try to let your upper body and shoulder relax into your thumb, because your thumb can only push so much, but if you let the weight of your body extend backwards, you can create that trigger point pressure that you need. And remember, 10 seconds, make sure you continue to breathe, and then stand up and move your thumb up about a quarter of an inch. Same thing, press your thumb into your back, lean backwards but to the side. And you're going to press or lean to the side that you're pressing on. And you want to do both sides, and remember the muscle is very short, So after you've done this maybe 3 times, you've moved up a half an inch or a quarter of an inch each time, you're going to run out of muscle. And this should feel like a good pain. If anything hurts, even just leaning back hurts, don't do this.